living in a time we're certainly living in a time where our connection to other people is even more vital than it had been before. And so what I'm going to address today is the link between social connection as well as mental health. Next slide. So I'm just going to go over very quickly the role of social connection, the impact that social connection has on mental health, as well as some of the challenges that may be faced in having social connection, and lastly, some of the strategies for enhancing that connection. Next slide. So obviously, this is a NAMI event, so we're well aware of the importance of mental health. And mental health is just part of our overall well-being, right? We also have to address our physical health as well as our spiritual health. And our bodies are all interconnected. As you may be aware of, whatever is going on in your mind is going to affect your body, is going to affect your spiritual health, and vice versa. And along with that connection, right, our minds can affect our physical health. If you're struggling with anxiety or depression, that can certainly impact your ability to feel good in your body physically, your overall functioning, your productivity. And of course, the main point of this topic is how does our mental health affect our relationships as well? Next slide. So these are, some of the more common mental health conditions, of course, depression, anxiety, bipolar, schizophrenia. As you know, these occur in varying, you know, varying levels. And what's really important to be aware of is that even though these disorders may present with psychological symptoms, they certainly have long-lasting repercussions, right? They can affect our relationships. They can affect, how we take care of ourselves or our families, how we interact with our community, and even how we view ourselves as well. And I think particularly when you're talking about minority communities, as we all know, there's an ongoing stigma when it comes to mental health conditions. So as much as we can have events like this, as much as somebody can walk away educated and tell somebody else, if you're struggling with any of these disorders, there is help available. We have done our job. Next slide. So what are some of the factors that impact mental health? Certainly genetics, right? Some of these disorders can certainly run in families, which can put you at higher risk. How the environment, right? We're certainly living in a very high stress time, which can increase certainly the risk of developing certain mental health disorders or even worsen disorders as well. We also have to look at the impact of trauma, like if you've been through a traumatic event, or even if you have witnessed a traumatic event, that can certainly predispose you to developing a mental health disorder, as well as your lifestyle, right? Your diet, your exercise, your sleep. And particularly when we're going through very stressful times, these are areas that you do not want to neglect. You want to make sure that you're still getting good sleep, good exercise, and that you're connecting to other people as well. Next slide. Next. So what do we mean by social connection? By nature, we are social beings. We are meant to live in community and connect to other people. So social connection certainly has to do with how we, in general, how do we connect to other people? How do we connect to people within our families? How do we connect to friends, to co-workers as well? So that's just a brief overview of what we mean by social connection. Next slide. As I mentioned, there are different types of social relationships. These could be romantic, professional, platonic, right, familial relationships. And with that varying level of relationships, one of the things I would always recommend is really doing an analysis, right? Really taking some time out and look at the quality of your relationships in these different areas. Am I connected to people in all of these areas, right? Am I having good, relationships with my family, co-workers, romantic relationships, professional relationships in general? How are these relationships working either for my benefit or am I also benefiting other people as well? Next slide. So as I mentioned earlier, we're meant to live in community. We're not meant to be isolated. And certainly the very nature of mental health disorders can predispose someone to withdrawing from community. If you're struggling with depression, the last thing you want to do is to be in a group and connect to people. You want to isolate. The danger in doing that is once you isolate, you run the risk of worsening your mental health condition. There may be the temptation to not want to connect to anybody, but it actually works against your benefit. So certainly as a psychiatrist, this is an area that I always discuss with patients at every appointment. How are you? How's your relationships? Are you getting out? Are you meeting people? What are you doing to improve that particular area? And is that area working to your benefit? Is it optimized at this point, right? Certainly, we've come out of the pandemic, and we all know that the pandemic, everybody was isolated. Social connections either got broken or they got changed. Some people liked the isolation of the pandemic. And then some people really struggled in that area. And so now we're out of it. There are people who are still struggling to connect. There's some people who will say, you know what, I don't necessarily know if I want to connect to people. I kind of like being on my own, right? So that's an area to really look at. How is my social connection prior to the pandemic and now? And really, what are my goals in terms of either developing social connections or improving those connections? Next slide. So why do we need to connect with other people? What is the benefit of doing that? We were not created in isolation, and there can be emotional support that comes out of having a community. All right. You're going through a difficult time, you're going through a challenge. It's necessary to have somebody who you can talk to, somebody who you can support. And one of the things I will say with emotional support is that not everybody is going to understand what you are going through. You're going to have to really determine who can I trust, who's going to be in my corner, who do I feel comfortable with sharing information with, right? Because one of the dangers you don't want to do is to overshare with somebody who can't handle what you're going through, okay? So social networks can also help you in general with coping, with life, with stress, right? Having that shoulder that you can lean on, that you can cry on. And it certainly gives you a sense of belonging, right? It gives you something to be a part of, right? This very event is a social event that allows you to connect to other people and not feel so isolated. So there's certainly a lot of positive mental health benefits that come out of having a community, right? Certainly it can improve happiness and joy. It can certainly help you to go through challenges. As I mentioned earlier, it can certainly reduce isolation. And what's even more interesting is a lot of research in terms of how social connection can certainly reduce your risk of chronic disease and overall wellness. When we are in isolation, it actually is worse for overall physical health. And people who are severely isolated will struggle with poor, not only mental, but as well as physical health. Next slide. So again, right, being part of a community can certainly help to decrease stress, can certainly help to reduce anxiety, can give you support. And one of the other benefits in terms of being part of a community is it can help with your lifestyle, right? Maybe you can have somebody that you can work out with, somebody who holds you accountable. So somebody can help you to stay on track with, eating patterns that you have. So there are numerous benefits that come out of being part of a community, and you do not have to do everything by yourself. Next slide. So the other benefit of social connection, it can certainly help with emotional resilience. And for those of you who don't know what resilience is, a basic definition of resilience is basically your ability to bounce back from adversity, right? And those adversities can come in multiple forms. But knowing that you have other people who can support you and who you can talk to and who are in your corner can certainly help with the recovery from adversities, right? Help you to cope with life's challenges, help to motivate you, to encourage you as well. Next slide. So I just wanted to address isolation and loneliness because this can really be a barrier to really gain in community and connecting with other people, right? So isolation and loneliness can have a very negative impact on our mental health. It can certainly worsen symptoms of anxiety and depression. When you're in isolation, your thoughts tend to be more negative, right? Which can also worsen those conditions. And it can leave you feeling in despair, feelings of helplessness, hopelessness, this idea that things will never get any better. And as I mentioned earlier, overall, it can worsen not only mental health, but as physical health as well. Next slide. So in 2023, the Surgeon General actually defined loneliness as a public health epidemic. And this is not only in the US, this is worldwide. Actually, in the UK, they created a governmental position called the Minister of Loneliness because it is such a huge problem worldwide, right? Even in the event of, certainly in the introduction of, social media, it seems we're more connected, but in reality, some of us are not, right? And in one poll in 2024 found that a third, so 30% of adults experience loneliness at least once a week, and 10% felt lonely on a daily basis. What's really interesting is that younger adults were more likely to report loneliness compared to older or married adults as well. So this is a huge problem that still needs to continue to be addressed. Next slide. So as I mentioned earlier, technology, right? Obviously, technology has its positive benefits. You can certainly connect to friends, families, different states across the world. But a relationship online cannot replace a face-to-face relationship, right? Those relationships online certainly have their place, but you also need to look at who am I connecting to in person? How do I improve those in-person connections as well? Next slide. So what are some of the barriers? What are some of the reasons that we may not connect to people as we should? Certainly time. We're all busy. We all have, lots of obligations. And really what I tell patients is that you're going to have to schedule time to connect to people. This is not something that's going to happen unless you intentionally make it happen as well, right? You may not be in a different state from somebody else, but certainly you can call them, maybe set up a time to meet in person. And we also have to look at how our mental health can certainly create barriers to connecting to other people. And this is something that you can certainly discuss with either your psychiatrist or your therapist if you find that you're having challenges with getting this done on your own, okay? And as I mentioned earlier, we're still in a post-pandemic adjustment. Just because the pandemic has ended, it does not mean that everything is back to the way it was. And that's an area that we certainly have to acknowledge. Next slide. So strategies, how do we improve this? Next slide. So find your tribe. You have to intentionally look for people that you connect to. You're not going to connect to everybody. Everybody's not going to be somebody that you like, or they may not necessarily like you as well, right? So it's really important to find people who have similar interests with you. And this is going to be a period where, you meet somebody, it may not be the right person. I always tell patients this, you're going to have to be consistent with this process, okay? Maintaining regular communication, right? Putting yourself out there and, calling somebody up and saying, okay, hey, do you want to have coffee? Do you want to do something with me? And overall, the more quality time you spend together, the more your relationships are strengthened. It takes time and it takes commitment, but at the end, it's absolutely worth the benefit that you get out of it. Next slide. Right. The other thing I would say is that, even if you have current relationships, work on building those relationships. Relationships that were pre-pandemic may not be at the same strength or the same level they are at this point in 2025, right? So intentionally work on connecting to people, doing events together, right? I always tell patients, Look at stepping outside of your comfort zone, right? Look at meetup groups or being part of organizations or trying different activities so that you're able to meet a variety of different people. And then look for volunteer or service opportunities. A great way to meet people is being able to be in an environment where people share your same interests or have your same motivation to help people. And in the process of helping somebody else, you feel better as well. Next slide. All right. So in conclusion, I hope you have a better understanding of the necessity of social connections, that we were created to be in community. This is not something that's going to happen by chance. You have to intentionally work on making this happen. And certainly give yourself patience and time as you build a community. This is not something that may happen in a couple of weeks. It may take a little bit longer, but definitely do not get discouraged. It is absolutely worth it. As I mentioned earlier, it can certainly not only benefit you mentally, but as well as physically. Okay. And again, I thank you for this invite, and I look forward to the rest of the program. Thank you.
Thank you, Dr. Williams. Let's give her a hand.